Your online radio. The new online radio that makes you happy.
Radio. Tune in, good vibes.
All-time favorites.
Over the years, I developed thoracic endometriosis. And what basically thoracic endometriosis is the lining of the uterus moving to other parts of the body. And in my case, moved to my lungs.
For thousands of years, severe pain related to the female reproductive system was documented but often wrongly attributed to unproven medical theories.
Every month while I was on my period, my lungs would collapse.
Being in so much pain that some nights I'm scared I'm not going to wake up the next morning.
Endometriosis is a condition where tissue similar to the lining of the uterus, endometrium, grows outside the uterus, usually on the ovaries, fallopian tubes, or pelvic lining. Like the normal endometrial lining inside the uterus, these misplaced tissues respond to monthly hormonal changes. They thicken, break down, and bleed during each menstrual cycle.
We do not talk about menstruation because they do not affect men. And in some of our cultures, menstruation is considered as dirty.
However, unlike menstrual blood from the uterus, this blood has no way to exit the body, resulting in inflammation, internal bleeding, scar tissues, adhesions, and often severe persistent pain. Adhesions are abnormal bands of scar tissue that form inside the body, causing internal organs and tissues to stick together.
Doctors would tell me it's in my head, or I'm seeking attention, yet I was in pain.
Endometriosis is a major global health concern. It is estimated to affect approximately 10% of women and girls of reproductive age worldwide, representing more than 190 million people. Endometriosis diagnoses are most prevalent to the women and the girls within the reproductive age bracket of 15 to 49 years.
I accessed a lot of suicide prevention counselling sessions from a charity. Like having to justify myself constantly, it broke me, to be honest. It really did.
Approximately 3.4 million new cases of endometriosis are diagnosed globally every year, according to the Global Burden of Disease database. In Kenya, about 1.2 million women and girls are living with endometriosis.
Endometriosis acts like cancer. It's not really cancer, but that's what it does. It's just going to infiltrate or invade these tissues. So all these planes or these spaces are completely obliterated. So you're trying to get space in a place where there's no space. It's very delicate because there are vital structures that are running in these spaces. There are blood vessels, there are nerves, and injury to these nerves and these structures could lead to, morbidity. So it's trying to make a way where there's absolutely no way. And this disease, it's aggressive.
Despite its high prevalence, diagnosis remains a significant challenge. On average, women experience a delay of 7 to 10 years before receiving an accurate diagnosis, often after multiple healthcare visits, because the symptoms are frequently mistaken for normal menstrual pain or gastrointestinal disorders.
I had severe pelvic pain from the start of puberty, so when I was around 11 or 12. Before my first period, I actually fainted, and then when I was 17, I had my appendix removed. When I had this procedure, they found multiple adhesions between my large bowel, small bowel.
The symptoms of endometriosis include chronic pelvic pain that worsens during menstruation, severe pain during or after sexual intercourse, and painful bowel movements or urination, particularly during the menstrual period. In addition, endometriosis is one of the leading causes of infertility, contributing to 30 to 50% of infertility cases among affected women due to damage to the fallopian tubes, pelvic adhesions, and impaired egg quality. Currently, there is no definitive cure for endometriosis and no scientifically proven method to prevent it. Nevertheless, its symptoms can be effectively managed through pain-relieving medications such as non-steroidal anti-inflammatory drugs, NSAIDs, hormonal therapies that suppress estrogen production and temporarily halt menstruation, or minimally invasive surgery, laparoscopy, to remove endometriotic lesions and scar tissue. These treatments can significantly improve quality of life and in many cases enhance fertility outcomes.
So surgery can take anywhere from, on average, from 30 minutes to 3 hours.
Although the cure for endometriosis remains indefinite, the cases of death are low, amounting to about 2 out of 1,000 women yearly. For every woman living with endometriosis, it is important to know that debilitating menstrual pain is not something that should simply be endured. Your pain is real, it is not your fault, and you're not alone. Speaking up, seeking early evaluation from a gynecologist, and assessing appropriate medical care are the first steps towards relieving symptoms, restoring your well-being, and living a healthier, more hopeful life. Reporting for this special segment, Endometriosis, my name is N Njeri.
Your online radio, the new online radio that makes you happy.
Hubzmedia. Tune in, good vibes.
All-time favorites.